Hello, everyone that is coming in. Welcome, 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 everyone. This is the Cancer Support Center's Kick It Cancer, some virtual symposium for our Be Fearless, Save Lives Cancer Prevention campaign. For those who are familiar with the campaign, we have launched mostly virtually this month to bring awareness around cancer prevention. And I'm very excited that you all are joining us tonight to learn and hear about the different things around cancer prevention, how incredibly important it is to especially um, be aware of the different preventative methods that's out there, and just be a part of this incredible initiative in this campaign. My name is Shamaya Bird. I am the program manager for Kick It Cancer at the Cancer Support Center. And again, welcome. I'm so excited you all decided to share your time with us tonight to hop on in and get this incredible information. So I just ask that as you come in, number one, you are alert and aware that we are recording. This is something that we want to make available to everyone who is a part of this to go back and share all the information that will be shared tonight. And just as a courtesy, friendly reminder, please be sure to put yourself on mute. If there's any background noise, feel free to deregulate, stretch as we go through this presentation as you please, and we will have a short Q&A at the end. So if you have any questions, you can definitely drop them in the chat. However, to ask questions directly, we will make time for that at the end of the presentation. So I'm just gonna give like a brief 1 minute synopsis on what kidney cancer is for those who aren't aware of what kidney cancer is, um, and why this initiative has pushed to have a cancer prevention campaign this month. And so kidney cancer is essentially an initiative, an incredible health equity initiative aimed at underserved communities to uptick the screenings and specifically breast and prostate cancers, in which these communities are dying at very high alarming rates. And so, what kidney cancer is doing is not only addressing the health inequities to these mortality rates and what's going on in these communities, but we're also bridging the gap. And so we're talking to community members, we're building relationships and partnerships to create new resources and expand existing resources within these accessible resources, let me say that, within these communities. And so what you're here for tonight is essentially getting is a part of that, right? It's getting the information out about preventative methods for various different cancers. So not just prostate and breast, but you'll hear about various different cancers, the guidelines and preventative methods around healthy lifestyles to help you maintain that healthy lifestyle around a cancer-free life. So without further ado, I am going to go straight into our presentation. Again, for those who just joining, we are recording. Please feel free to drop questions in the chat, and we will have a short Q&A at the end of our symposium tonight. Thank you all again for joining. And I'm going to introduce our first speaker. We have Dr. Ari Seifter. Give me 1 second here. And I'm going to make you a co-host, Dr. Seifter. So Dr. Ari Seifter was born and raised in Baltimore area and completed his medical school at the University of Maryland. He subsequently moved to the Chicagoland area where he completed his internal medicine residency at Loyola University in Maywood and his Hematology Oncology Fellowship at the University of Illinois Chicago. He is currently a hematologist and oncologist at Advocate Medical Group, primarily seeing patients in the South Suburbs at Advocate Christ Hospital in Oaklawn and Advocate South Suburban Hospital in Hazel Crest. Dr. Ari, I'm going to pass it to you.
Thank you so much. I'm going to try to share my screen here. Oh, never mind that.
I'm making you a co-host now. Okay,
Right.
you should be good to go.
Okay. Let me try again. Here we go. And this should be viewable now, I hope. Okay. I'm trying to get it to run the slideshow. This is me. Thank you for the introduction. I am just gonna kind of talk in a basic way about the fundamentals of cancer screening, the guidelines of the current cancers that we do a lot of routine screening for, and why it's especially important to be talking about these things for the communities where I'm a physician on the South Side, because we see that there are definitely disparities, and not everyone has the same access to screening or outcomes. So first, I just want to talk about the basic principles of cancer screening. And so the main thing when we talk about cancer screening, that means that we're looking in people that are asymptomatic. So this is something that a lot of people, including myself, are guilty of, is, you know, maybe not going to a doctor unless they're having symptoms or a reason they're seeing somebody. But the important thing to think about is that cancer is most treatable and curable at an earlier stage. Those earlier stage cancers are often so small they're not causing any symptoms at all. So it's important to find cancers even when they're not causing symptoms. Ideally, for a cancer to be amenable to being screened, it has to be a relatively common cancer, so that you find enough of them. If you're looking for a 1 in a million condition, it's so much of a needle in a haystack, you'll end up with a lot more false positives and doing more harm than good. Another important thing is that you should be able to have a window of opportunity. So meaning there should be an early stage to the cancer that lasts for enough time that you're able to find it, that you have an effective treatment to give to people once you find it. Because if I had a screening test for a condition I can't treat, then all I do is cause someone a lot of anxiety and harm to say, oh yes, you have this condition, I can't do anything about it. And of course, it's important to have a safe and an accurate and ideally cost-effective test that we can use to identify this. This graph on this side is just to point out, you know, there's a traditional 4 stages of cancers, and these are some of the common cancers that we see. Not all of these are ones we're going to talk about, but 4 out of the 5 are ones that we have screening for. And as you see, the rates of survival when you catch something in stage 1 are much higher than when it's already stage 4 by the time you've been diagnosed. So this is old data from 2007, but I just find the graphic to say a lot about the types of cancer that are most common. On the right is men, as you can see, because there's the large prostate cancer, which women don't have. And on the left is women, who have the majority of breast cancers, and they're of course rare male breast cancer patients. And you'll see that the cancers that are more common, that have the kind of large bars out here, are a lot of the ones that we talk about in terms of screening. And the ones that have these kind of large difference, you can see here, prostate cancer, we have a lot of new cases, but not a lot of deaths. Same for breast cancer. These are some of the cancers that have very effective treatments when we catch it early, and that's why we have so many survivors for some of these cancers. And we're going to talk about staging for lung cancer, colon cancer, breast cancer. Pancreatic cancer, we're still not there yet. Unfortunately, it's one of the cancers I specialize in. Prostate cancer. So a lot of these most common cancers are the ones that we screen for because it's most effective. So starting out with breast cancer, this is a table. It's kind of busy. The important thing to say about this is that there's some differences in the guidelines. There's some controversy around it. Um, for and an important thing to say is for all of these guidelines are for average risk women, which is basically saying I'm going to take someone randomly off the street that I have no idea of their personal medical history or personal family history, anyone. So this is kind of the later end of what the guidelines would be. We'll talk about what might make somebody a higher than average risk, but essentially for mammography, which is the which is the screening test used for breast cancer, the guidelines range from starting at age 40 to starting at age 50, and somewhere between once a year or once every 2 years. So there's some wiggle room. You may hear different things from different doctors, different expert panels say different things, but somewhere around age 40 to age 50 for someone with no family history, you should be getting your first mammogram and doing it once a year or once every other year. In terms of things that might make someone higher risk and other testing that exists, for patients that have, for example, certain mutations running through their family, like the BRCA gene or BRCA, which some people might have heard of, there are certain calculators that you can do based on your family history. And if you say, wow, your risk is over 1 in 5 of having breast cancer at some point in your life, an MRI ends up being recommended. It's kind of a lot of detail. I honestly don't have these things memorized. When I have a patient come in, I kind of look it up for their individual situation, and I use these risk calculators online a lot. The general rule of thumb for people, that what I tell people that's easy to remember, is if you have a first degree relative, meaning your parent or a sibling, so brother or sister, that has had breast cancer, the general rule is you better start your mammogram 10 years before your family member was diagnosed. So if you say, oh, my sister was diagnosed with breast cancer at age 42, okay, that means you should get your first mammogram at age 32. And your sister's daughters should get mammograms starting at age 32 because their parent will have had breast cancer at age 42. And the idea behind that is that you definitely want to be able to catch cancer earlier than whenever somebody was diagnosed with it. The risks of cancers go up with age, but if we know there's a family history that someone's getting it young, we want to catch anything at an earlier age for their family members. And this rule generally follows for things like colon cancer and other things that we talk about. So if your father had colon cancer at age 42, unfortunately, that means you should get your colonoscopy starting at age 32. So, excuse me. This is some data just kind of looking into some of the disparities we see by race in terms of how common breast cancer is and the types of breast cancer that we see, and also the differences in outcome. So on this graph on the left, you'll actually see that in white patients is actually the highest risk of being diagnosed with breast cancer over here, followed just behind by Black patients, which are both higher risk than other ethnicities. But you'll see here that our Black patients still have maybe a 30% increased risk of actually dying of their breast cancer. And so this is showing disparities across the board. I think there's a lot of research going into this, and a lot of it actually comes out to systemic racism in our communities in terms of the access people have to get it diagnosed early, in terms of the access to treatments. There is some difference too, though, even genetically in the type of cancers that we see. So on this side, you'll see in the dark pink, these are the hormone receptor positive breast cancers, which tend to be a little bit slower and a little bit lower risk. And those are more common in our white populations. In the Black populations, these gray, what we call triple negative tumors, which tend to be a little bit higher risk, are more common. So there's also research into saying, is that genetic? Are there environmental factors based on where people live? There were studies done out of University of Illinois, Chicago, where I did fellowship, that said the zip code where you live makes a big difference in these things, just as much as race that you put down. So I think there's still a lot that we need to know, but it's going to be a common theme that you see that we are dealing with a lot of disparities. And looking further into that, in terms of here in the pink are the breast cancers that are localized at the time that we find them. The lighter pink is regional. Those are the ones that are treated with the intent to cure them. But of course, the localized ones have a higher cure rate than regional. And if you find it when it's distant, unfortunately, it's very treatable, but not curable. And as you can see, there are differences in terms of how early are these cancers being caught. And here we see trends, excuse me, dating back 40 years. And yes, while we're making definite progress in terms of the risk of cancer deaths from breast cancer over the past 20 years, you see there's clearly a large disparity here where our Black populations have by far the highest rate of breast cancer deaths. So this is something we really need to work on as a society. And my goal is to kind of get the word out for people to get screened so that if they are diagnosed, we get them in this early stage and move them to be cured. So moving on to colon cancer, we see here, this one is kind of less controversial. It used to be age 50 for the first colonoscopy, but now recently it's moved to age 45. So sorry for everybody that was waiting until age 50, 45 is now the guideline for everybody. Certain people have higher risk if you have inflammatory bowel disease, if you have family history of certain types of polyps or colon cancer. If you've had prior radiation, that's a less common cause, or other family history. I'm falling behind. I'm going to try to move more quickly. Multiple different types of tests can be done for colon cancer, varying in how invasive they are. The colonoscopy is honestly favored. I'm going to get into that in the next slide. But the best screening is the one that you're willing to do. So I have a lot of patients, you describe the colonoscopy. This is usually men, by the way, who are like, nope, there's nothing you can do to ever convince me to do a colonoscopy. Then fine, we can do these stool sample tests once a year or up to every 3 years with the new Cologuard test. The problem is with these tests, if they come back positive, you still have to go to the colonoscopy. And the advantage of the colonoscopy is that it's not just diagnostic, but you are actually finding polyps and precancers and removing them before they become an issue, which is not the case when you do the stool test necessarily. So ultimately, the colonoscopy is what I'm going to do for myself and make my wife do when we turn 45. If your colonoscopy is normal, it's every 10 years. If they find certain types of precancers, it becomes more frequent. But colon cancer is becoming much more common in younger populations. And so I really feel strongly about getting this done. We're going to see, again, disparities. In this case, unlike breast cancer, colon cancer is just also more commonly diagnosed in Black patients. And the thing I want to highlight on this graph is when we catch colon cancer early in this local stage here, it doesn't matter, who you are, where you come from, your cure rate is pretty good, around 90%. So our treatments are just as effective for everybody. But you'll see that more frequently, I don't have a graph of it, but more frequently, Black patients are getting diagnosed later at the regional or distant stage, probably because of poor access to these screening and appropriate testing. And again, that's something that we need to improve on as a society. For prostate cancer, which, as you heard, is another major initiative for cancer, this one is similar to breast cancer, that it is more controversial and all over the map. Some societies say, hey, talk about it, whether it's a good idea. The issue is that the treatment of prostate cancer, in terms of getting your prostate removed with a radical prostatectomy or even radiation, can cause a lot of side effects in terms of urinary incontinence and sexual dysfunction. And sometimes there are very early prostate cancers that you can detect that don't end up causing problem for a number of years. And so it's controversial. But in higher risk populations, which I would include Black patients in because of the data we're about to see, I think it's important to get the screening done, and you can decide what to do with the information once you have it. Screening for prostate cancer is very easy. It's just a blood test, usually once a year. If the blood test is elevated, then it may be recommended to do a biopsy. And more of these MRIs are being done to try to spare people the biopsy. I'm not going to get into too much detail of what the biopsy entails, but it's not anyone's idea of fun or, how they'd want to spend their Friday afternoon. So if we can avoid those, we try to. Sorry, skipped. Prostate cancer is another one which huge disparities, way more common in Black patients. And you can see it kind of tracks as well as the number of deaths caused by prostate cancer. So this is one where compared to other cancers, my recommendation to a patient I'm seeing the first time may be different for a Black patient who has double the risk of prostate cancer compared to other groups. In terms of lung cancer, screening is really only done for people who have smoking histories, because smoking is far and away the #1 risk for lung cancer. It's still yet to be seen what's going to come out with risks for things like vaping and all the stuff that is kind of newer onto the scene. The current guidelines are if you are age 50 to 80 and you have a 20 pack year smoking history. So pack years is the number of years you smoked multiplied by the number of packs per day. So if you smoke a half of a pack per day, you would need to have smoked for 40 years to reach 20 pack years. Of course, you have to be honest about how many packs a day you are smoking. So if you smoked 1 pack per day from age 15 to age 35, there's your 20 pack year history. And you have to have not quit within the past 15 years. So once you've quit 15 years ago, if you quit smoking at age 40, at age 55, you can stop doing the lung cancer screening by the current guidelines. This is a CT scan done once a year, a low dose CT scan. And this is an example of a type of spot they might see on there before you would have any symptoms. And the goal of this is to catch it early where it can be treated with surgery or radiation and be cured. Finally, I think cervical cancer is the last one. This, again, has slight variances to the data around it. For the most part, it starts earlier than our other cancer screenings. Usually at age 21 is the guideline that I go by. From age 21 to 30, it's a pap smear every 3 years. Once you hit age 30, as you go from age 30 to 65, you can ask to have the pap smear combined with what's called an HPV test, the human papillomavirus, and they'll check for the presence of the high-risk HPV strains. What I found with my own wife is that not everyone has moved to this. We're over 30 now, and I think she's getting the pap smears more often still, but this is an option. And certainly, I don't think my wife would be that impressed with me telling people, oh yeah, get all these pap smears. It's so easy, my having obviously never been through it, but it's somewhere in the every 3 to 5 years is what's recommended by these societies. I think some gynecologists will do it more often. And after age 65 is when you're done with it. So it's, a number of years that you're undergoing that screening. And even more important than screening, maybe nowadays, we have an HPV vaccine that hits the high-risk HPV, the ones that cause genital warts, cervical cancer, vaginal and vulvar cancer, and actually HPV is highly related to certain head and neck cancers, which we don't screen for. So this is actually recommended for both boys and girls up to at least from age 11 up to at least age 26. Some people think about giving it older, but for our young populations, getting these vaccines will prevent you from picking up these viruses during that period of your life and then not being at risk to develop be much lower risk to develop these types of cancer later on. So I think it's an important plug for our young populations to do that, maybe our kids. And I think that's all I have.
Thank you, Dr. Seifter. That was an incredible, very packed presentation, but I think super important information for everyone to grasp on there. I know I have a few questions myself, so we'll definitely get to the questions at the end. But thank you again, Dr. Scheifter, for sharing your expertise. There's definitely some alarming disparities. And as we shift from Dr. Scheifter's screening guidelines, we're going to go next into um, Michelle Myles, who I'm very excited is with us as well tonight. And so this whole entire symposium is sort of like a get your action plan ready, right? It's not just getting the information, absorbing the information, but it's one step to the next. So now we have our guidelines. We're going to go into preventative methods and listen to what Ms. Myles have to share. So let me go into Ms. Myles' bio. Give me one second. So Dr. Michelle D. Myles is the president of Chamberlain University's Tinley Park campus. She has served in this role for 2 years, and she brings 28 years of combined academic, administrative, clinical, and regulatory experience. Dr. Myles earned a Bachelor of Science in Nursing from the University of Illinois at Chicago. She holds a Master's of Science in Nursing from Governor State University in Illinois and a Doctor of Nursing Practice from Rush University of Nursing in Illinois. She has earned certifications as a nurse educator and Lean Six Sigma Green Belt. So without further ado, everyone, Dr. Michelle Myles. Thank you, Dr. Myles.
Thank you, Shamaya, and thank you, Dr. Scheifter, for the valuable information. If you can hear me okay, that is great. I decided not to provide a PowerPoint because I really wanted to have the time with you all to dialogue from a partner perspective in terms of partnering with you to support you making healthier choices and kicking cancer together through a partnership. I appreciate you all being with us this evening on a Monday, and I look forward to your questions that you may have towards the end of our time together. Dr. Scheifter sent and shared a lot of information. So as you process some of the information in terms of screenings, how does that relate to your choice to implement an action plan for healthier living? What does it look like and feel like to lead a healthier lifestyle to decrease your personal risk of cancer as well as those of your loved ones? So take a few moments. You can type in the chat if you feel comfortable, or you can write a note on a piece of paper. As you reflect on the information from Dr. Scheifter in relation to the cancer screenings, think about what comes to mind for you in relation to partnering in that process for cancer screenings. Think about that. What does it mean to partner with a healthcare professional for your screenings? Because you matter. Your health matters. Making a choice today matters. Because as Dr. Scheifter referred to specific risk factors of cancer or the complications and the existing effects of cancer if it's not identified early. And the life expectancy, perhaps, for those who have identified cancer earlier than those who might not have. He also talked about health inequities and healthcare disparities. So type in the chat, how many of you right now today would feel comfortable with your healthcare provider, talking to them personally about your lifestyle? Think about that. Type in the chat. How many of you would feel comfortable talking to your healthcare provider, okay, about your health status? Deborah says she would. Good job. Okay, Christina says, I do. Who else? Do you feel comfortable talking to your healthcare providers? Okay. For those of you who do feel comfortable, that's great. Because when we talk about and think about healthier choices and making healthier lifestyle choices, to me, that is dependent upon the relationships that you have with your healthcare providers. Some of these health disparities and inequities can be due to the lack of trust that an individual can have with their healthcare provider. Dr. Seifter also gave statistics about the differences in cancer with certain ethnic groups. What's the reason you believe some of those differences exist? What could be the reason some of those health inequities and those healthcare disparities exist? Now, health inequity is a difference in terms of the health of someone based upon their ethnic group. And as a result, that could lead to a disparity, a difference in the gap between those who are diagnosed with cancer and those who potentially survive. So what could be some reasons for that? Some of you indicated in the chat, which is great. I appreciate your participation. Some of you indicated you feel comfortable with your healthcare provider. Do you have a relationship with them? Does that comfortableness lead to a partnership in a relationship? So you can talk to them about symptoms that you are exhibiting. Type in the chat, would you feel comfortable? Because we're talking about healthy choices and kicking cancer. And it starts with making a choice, but also partnering with your healthcare providers and sharing with them specific symptoms that you have. Dr. Seifter also spoke about racism. How many of you believe racism has impacted health inequities and health disparities? Okay, Kelsey is nodding. All right, and Shemaya is nodding, and Christina. Exactly. And Deborah's nodding as well. That relationship, we're talking about choices, and now relationships, they matter. As a healthcare provider, as a registered professional nurse, my interactions with you matters. Because if I don't establish an appropriate relationship or rapport with you, that can impact your ability to share information with me that I need to know to help determine whether you have a risk factor or not, whether you have family history or not, whether you should go ahead on and be tested for something. Yes, risk factors matter. Also, symptoms. If you're not communicating with your healthcare provider, who's your partner, the symptoms that you're experiencing, it's going to make it more difficult for them to determine if you should be tested for something, even though you may not have a family history. So I see you all are typing in the chat. And Deborah said, yes, she has a relationship with her specialist. Your internist is personable and racism is a factor. It could be a factor in terms of health inequities and disparities, because we're talking about choices to be healthier and we're talking about relationships. Your doctor takes his or her time with you. That's important. Colleen, I'm lucky to have a great team. Yes, it matters. The partnership, the team, the care team matters. The communication that's discussed and the plan that's discussed with that care team matters. So we've talked about choices. We've talked about relationships. What about environment? How does the environment that you currently live in or your loved ones, how does that impact your risk of developing cancer? Think about your environment, where you live, clean air in your environment, clean water in your environment. Yes, it is a choice to choose to be healthy. You're correct. But there are factors such as relationships in your environment that can impact your ability and the choice you make to be healthy. Someone type in the chat, food deserts. Yes, yes, yes. So based upon what Deborah put in the chat, are you all aware that there are certain things such as food deserts? There are places where you may live, your family and loved ones, where I or others may live, where there is not healthy food options available. But there are highly processed foods with a high sodium content available because they're cheaper. Christina, a lack of education about healthy eating. That is a great point. So, environment, relationships impacts the choices that we make to all be healthier. So now, when we think about leading a healthier lifestyle, what does lifestyle mean to you? Think about it. When you hear the word lifestyle, what does that mean? Lifestyle. What's the style of your life? What are your thoughts? What do you value in terms of your life? Do you value healthy eating options? Do you value, yes, everyday routines? Exactly. Do you value physical activity? Do you value not smoking? Do you value not drinking certain beverages that can increase your risk of cancer? Exercise, you are correct, Colleen, physical activity. Now think about this. And what else? It's more difficult when someone in your household doesn't have the same beliefs about healthy foods. Correct, Christina. So I can choose to be healthier. But if my family members don't see it the same way, is that going to make it more difficult for Christina to bring healthy choices in? Yeah, because everyone else is going to be less, it's going to be more likely to, I don't want that. And it's costly to have nutritious foods such as fruits and vegetables. It's not that people don't want to try to live healthier lifestyles. Sometimes it's the constraints in the environment that's impacting them. Colleen also talked about, typed in the chat, stress, the stress response, short-term stress, that fight or flight. So when you're trying to run away from a dog that you didn't know was coming and it seems like the dog is trying to come attack you, that fight or flight stress response kicks in and you want to run away, right? But that long-term stress, because of food insecurity, not having enough food, so you're gonna probably get the less costly option to help your family to have some type of food on their table. All that impacts your choices to be healthy. And also, if the relationships with your healthcare providers do not afford you the opportunity to ask questions, to ask for resources, that can be impactful to your health and your environment. So it's not just one thing, it's multiple variables that can impact your desire and commitment to be healthy. That's why registered professional nurses, and I'm one, so I can speak to it, even though I'm in academia as a campus leader, it's important that we educate our students on the importance of forming relationships with each and every one of you. Because primary prevention means ensuring physical activity takes place, ensuring hydration, exercising, portion sizes for foods, healthy food choices. Primary prevention is critical to decreasing the risk of cancer. Primary prevention before any type of cancer occurs. Secondary prevention are the screenings that Dr. Seifter spoke to. And then tertiary prevention is after the disease has been diagnosed. And as Dr. Seifter indicated, certain ethnic groups have been identified as having cancer in the later stages for the reasons we spoke about. So yes, all these variables are important to lead a healthier lifestyle. Yes, it is important that our families, our communities, even your community is involved in the discussion, is involved in making sure not only you as an individual is healthier, but that environment that you're in. Because you need clean, healthy water, because hydration is important as well, and clean air. Dr. Seifter talked about and showed examples of specific cancers, lung cancer, respiratory cancers, because of what we inhale in the environments that we're in. So eating healthier can be difficult. So it's important you partner with your healthcare providers, your nurses, your communities, your hospital centers. In addition to that, your faith-based communities as well. Physical activity is important to achieving an appropriate weight. And as someone typed in the chat, stress can also impact weight. It can cause some people to eat more, or it can cause people to burn off more calories and end up losing weight because of how they individually respond and cope with stress. Type in the chat, what do you think about what I've been communicating so far? Yes, we can make a choice. Yes, it's important to partner. The environment plays a role as well. Yes, we can. Christina, you better believe it. It starts with each one of us individually being empowered to have those conversations with the healthcare providers, because we know unhealthy choices, how much you eat, what you eat, the exercise you are able to participate in, because some people in your environment may not be able to participate in certain physical activity because of safety. Also, too, when we think about this, financial means to eat healthier, all those factors play a role. So as a partner with your health and to help you be a healthier you and the best healthier you can be, it's not just one thing. It's multifaceted, it's complex. Yes, there needs to be more education on healthy lifestyles. You better believe it. And what that looks like and feels like, based on what, Deborah? Based upon that person's life environment and where they live. Because if you live in a high crime area, you can talk to me about physical activity, but am I gonna go outside to run? No. So when we think about policies and guidelines to help keep our communities healthy, all of us, our voices matter. Talk to your aldermen, talk to your policy and decision makers, because everyone has a right to lead a healthy lifestyle. It shouldn't be, if my area code is different from someone else's, that the life expectancy is 10 or 20 years different. That should not be the case, not in the United States. So what you take away today, use that to empower you to continue to make choices, to advocate for yourself based upon the relationships you build with healthcare providers, so your environments can change for the better, because everyone deserves to actualize or live out their fullest potential by being healthy in mind, body, and spirit. Thank you.
Thank you, Dr. Myles. Wow, what a powerful presentation without the PowerPoint. That was very engaging, and I thought it was so cool how you broke down the different methods of different phases of care, the primary, secondary, and tertiary. Like, that was super informative. And so I hope that everyone really feel empowered by that powerful message behind what Dr. Myles shared with us this evening. Thank you again, Dr. Myles. And again, just a gentle reminder, We will have questions at the end, but if you have any questions, feel free to drop it in the chat now, but we will have some time for you all to ask both Dr. Seifter and Dr. Myles questions. Moving along, we are near the end here. Thank you all again for hanging in with us and getting this information. We have one last speaker who I'm really excited to introduce. She's a part of the Cancer Support Center family, and she is our occupational therapy intern. We have Kelsey Fedor with us, who is currently a doctorate student at Midwestern University. Her anticipation graduation day is May 2022, so that's this year, really soon. I'm very excited for her. She'll be getting a doctorate with occupational therapy, and she's hoping to work in oncology or mental health post-graduation. So Kelsey, you can come on in and you're already a co-host, so you can go ahead and share your screen.
All right, hi everybody. I've got a screen to share. I can figure it out. All right, perfect. Hopefully everyone can see that. Let me know if it isn't moving like the first one. But yeah, my name's Kelsey. I'm an occupational therapy student, only until May. So then I'll be all complete. But I'm doing a internship at the Cancer Support Center right now. And just wanted to add on to the two great presentations that we heard today about screening, prevention, and healthy lifestyles, and sort of help everybody actually use what we've heard and apply it into our life, because like Shamaya was saying, it's really important to not only hear this information and understand it, but actually implement it into our life. Otherwise, that information doesn't do us much good. So I already introduced myself, and so did Shamaya, but that's me. And I'm a cancer caregiver myself, which is why I'm doing my internship with the Cancer Support Center, and why this topic of prevention is so important and close to my heart. My mom has been battling breast cancer since 2009, which puts me at a little bit higher risk because of that primary family member. So I am always telling everybody about how important prevention is and healthy lifestyles. So I'm glad to be able to kind of share that with everybody else. So just in case anybody isn't familiar with what occupational therapy is, if you aren't familiar, don't feel bad, because it is very misunderstood and not really known as it should be, especially in oncology. So that's part of also why I'm here today. So our kind of main definition is the therapeutic use of everyday life occupations with persons, groups, or populations for the purpose of enhancing or enabling participation. So what that really means is OTs try to help you participate in anything that occupies your time. A lot of people, when they hear occupational therapy, think they specifically go to work and, you know, returning to work if you're hurt, things like that, which is a part of it. But our word occupations really is just anything that occupies your time. So we help to overcome physical, environmental, or mental barriers that are preventing you from participating kind of to the maximum of your ability, or that you would like to. So this is just sort of a list of all the things OT can help with. It can be anything from, you know, just getting dressed in the morning, very easy activities, or not easy, but kind of basic activities of your life, all the way to helping you find hobbies, helping you take care of others. And my favorite is the one all the way on the right, which is helping people kind of fulfill their life roles. So whether that's, you know, you're a friend, a spouse, a survivor, a video game enthusiast, whatever those things are, we like to help you make sure you're able to participate fully. And one of those things that we do for that is something called action planning. which we've mentioned a little bit today, but this is just kind of helping you add behaviors or activities into your daily schedule and helping you kind of achieve goals. So we learned a whole lot of really important things in the presentation today, such as, eating healthy, stopping smoking, getting your screenings done. So I just wanted to help and kind of make this a visual of how to actually implement all of those things that we learned today into your life. So the first one that I urge everybody to do is to be taking the Kick It Cancer Pledge and visiting the Cancer Support Center website. Because of the Kick It Cancer initiative, our website has all kinds of different resources for you in many different communities. So you can see exactly where to go for screening, for prevention in your own community, which, like we talked about, like Dr. Myles talked about, is so important to your actual overall health, getting that care that you need where you need it and with people that understand all the other factors that are going on for you. So that little QR code that's on here will take you to the Kick It Cancer Pledge, and it just goes through the different cancers that you should be screened for and helps keep you a little bit accountable, which is an important part of goal setting also. So I urge everybody to do that. I'll also send this PowerPoint in the chat at the end so that you'll have that QR code, and our website is on here too. So this is sort of how the action planning kind of template looks. So I'm going to use taking the Kick It Cancer Pledge and going to our website for resources as our example for how to make an action plan and how to implement it into our life. So the first thing is you just identify what you want to add in, what behavior you want, or what goal that you have. So this can be, like I said, can be anything. It can be to stop smoking, to go get your colonoscopy, to take the Kick It Cancer Pledge. That's going to be everybody's for today. So let me see if I can. Oh, wait, I didn't actually mean to do that. So the first one that I'm going to do is to say that I want to be fearless and save lives, which is our little tagline for this today. I'm going to kind of go back and forth. Didn't do this slide exactly how I wanted, but it'll work. We'll figure it out today. So after you decide what you want to do, the second step is to brainstorm strategies that can help you achieve this goal. So if your goal is to take that pledge, it can be to scan the QR code, to have a reminder in your phone that, reminds you, did you do this? If you're wanting to stop smoking, this can be to use nicotine gum. It can be to have a partner to do this with, things like that. So as many strategies that you can write down, the better. Because then for step 3, you're going to select one or more of those strategies to keep or to kind of help you reach that goal. And sometimes you need more than one. So if your goal is to kind of work on your prevention, like I said in this one, the things I chose were to do the pledge and to visit the website, because those resources will help me, with above being fearless and saving lives, even if that's my own. If yours was to quit smoking, you can choose to, use the nicotine gum, or use some people, there's an app that helps people quit smoking, or, you need to do it with a friend. So if you need multiple ways to do something, I think that's better, because the more strategies you give yourself, the more successful that you'll be. And then the next step for whatever you decide is to just make your plan. And it's important to add how often you want to do this and why it's important to you. So reminding yourself why adding this behavior is important is really helpful to keep it in your schedule, because then you'll be reminded of why this is an important thing to do. And having how often you'll do it helps you keep this goal measurable, so that you'll know if you actually achieved it or not. So for this one, kind of putting it all together, I said, I will be fearless and save lives to reduce my risk for cancer and promote early detection by signing the Kick It Cancer Screening Pledge and visiting cancersupportcenter.org to learn more about screening resources in my community. And I said, I'll do this by scanning the QR code and filling out the pledge. And then I said when I want to do it. So I said by Wednesday at noon. That gives me all of tomorrow to work on this. It shouldn't take that long, but it gives me a deadline. And because I gave myself a decent amount of time, that helps with the last piece, which is really the most important part. It's how confident are you that you can achieve this desired goal or behavior? And we want you to rate it between 1 and 10. And our goal is to be at a 7 or above. The studies have shown if someone is a 7 confidence level or above, then the chances of this actually becoming a habit or a reached goal is significantly better. So for our goal here of checking out our resources and signing the pledge by Wednesday at noon, because I gave myself a long time to, a good amount of time to do that. And this is not a very hard goal. I can go on a website and look up some resources. I'm giving myself a 10 because there's really no reason I shouldn't be able to do this. And because it's very important to me. That makes my confidence level go up too, because I know why I want to do this. If you kind of go through your whole goal and you realistically think, I'm really at like a 5. I might do that, I might not. Then we want you to go back and look at maybe adding an extra strategy or giving yourself more time, adding someone that will keep you accountable. All those kind of things can be helpful. So we want you to be to that 7 or above. Like I said, if you don't reach your goal, even if you were really confident, all you would do is just kind of redo this process, see maybe why you weren't able to reach your goal. Did you just forget? Did you, if you're, saying you're going to quit and you said you were going to do cold turkey and that didn't work, maybe then give yourself a little bit more wiggle room, give yourself an extra strategy, or maybe say, I'm just going to reduce how many cigarettes I have for the day, things like that, so that you're making the goal a little bit more attainable for yourself. And then you can always build on top of that. So I did include, I thought I did. Before I send this out, I'll have an extra blank form for this so that you can print it out or go just on your computer and fill this out so that you can use this little template for any goals that you want to do from today. So whether that's scheduling your screening appointments with your doctors, getting more exercise in, just learning more about maybe your risk factors, anything, you can use this template and use it for really anything you want to add to your life that's healthy. But I'll add an extra blank one so you can do that. And like I said, we want it to be 7 or higher, just so that helps you actually achieve your goal. And I've included all the Cancer Support Center websites because the Kick It Cancer part of our website really does have some great resources and they're community specific.
And then I have a couple younger children that will be getting it. But my question, I don't think I heard for my older children that they should continue. I think they only had
it's not that they continue it. Once they've gotten it, they're good.
Okay.
The confusing part that what I meant to say is, so it's recommended up to age 26. There are some people that missed the boat on it
when they were in
now they're
like
age
11.
30, and the question is, should they get the vaccine now that they're age 30? Right now, the guidelines say no, but in certain situations, which would be discussed with a primary care doctor, they might try to give it anyway. But if your kids already got the series, they're good.
Okay. Okay. The one question along with that, I can't recall, and I know I can check with their providers, but oh gosh, I'm sorry, that was actually my doctor. I wish I didn't not answer it. Oh, if they happen to miss a step, isn't there 3 doses or is it 2?
That's right. I remember it being 3.
Okay.
Yeah, that's what I think.
I need to follow up because I can't remember if one of them missed, and I definitely obviously want to make sure that they're covered.
Right. Yeah.
I do have one question for Kelsey too, real quick. Kelsey, are you available for OT appointment?
Yeah, right now I'm just taking people at the Cancer Support Center, but yeah.
Okay. I live right behind the library in Homewood. Is that the one you're at?
I'm at both, yeah. So
Okay. I can reach out to you.
Yeah, I can put my email in here too in case anybody else wants one too, because I'm doing individual consultations. So
okay, thank you.
And I apologize, guys. Technology did boot me out. Thankfully, you all were still on though when I logged back in. So if anyone have any questions, this is definitely the time to ask questions. But I just want to again thank our speakers for coming out tonight. Thank you all for giving us about a little bit over an hour of your time tonight on a Monday night. I know that's not always an easy thing to do, but I do appreciate you all tuning in and getting this really important information. And one thing I just want to add, Kelsey, really great presentation. I think it really tied both Dr. Myles and Dr. Seifter's presentations beautifully together. But I do want to urge folks to take the pledge. Everything that Dr. Myles said and the screening guidelines that Dr. Seifter gave is sort of the information. Now we want to take the actual action step to really take accountability of our health. Because as Dr. Myles says, it is important and you all matter. Your health matters. So I'm going to close it on that. And if any other folks have questions for either three of our speakers, please feel free to take yourself off mute and ask questions. Well, I know I did have one question for you, Dr. Scheifter, for the lung cancer screening guidelines. I'm not sure if I read it on there, but did it state how often you should be getting screened for lung?
Yeah. So, excuse me, for the patients that fit in the criteria of getting lung cancer screening, it's a CT scan once a year. Now that assumes that it's a normal CT scan, because some patients will go in, they'll say, oh, there's this spot. It's probably not cancer, but we should follow it up with another CT scan in 3 or 6 months. But the typical is once a year. And it starts at age, excuse me, starts at age 50 on the early end, but it's only based on smoking history. So someone with no history of smoking as of today, and today's guidelines do not need particular screening for lung cancer. And a point that Michelle made is very important, I think. Screening is about no symptoms, right? So this is, if you have no symptoms and walk into my office at age 45, you should get a colonoscopy. But certainly there's no magic formula that says you can't get colon cancer before age 45. But for those patients, that's where when you do get symptoms, oh, I have some blood in my stool. Oh, I have this belly pain that isn't going away. Oh, I'm losing weight without even trying to. Getting those things evaluated really early on can make a difference before things get even worse. So that's something where it's technically diagnostic testing and not screening testing, but that's another thing that's really important, is that if you have a cough like I'm exhibiting right now, except mine is from a cold from my toddler, a cough that's not going away, well, that should get checked out whether or not you have a history of smoking, you know, and of course there are other environmental factors, living with a smoker, working right next to a plant, you know, with smoke and other pollutants coming out of it. So these guidelines are meant to be one size fits all, but we know that it's not really one size fits all.
Great point. Great point. I have one question for you, Dr. Myles, and if no one else have questions, we'll go ahead and we won't hold you all any further. But we do want to be respectful of everyone's time. So if no one else have questions, we'll close us out here. But Dr. Myles, you talked a lot about building relationship with your primary, and it's something that I advocate on a lot because it is super important to establish that relationship. But what we know is that not everyone feels confident enough to advocate for themselves and building relationships with their doctors. And I think that's sort of some exhibits some power dynamics there. But what would you say to folks who don't have confidence in either seeking another primary who could make them feel more comfortable, or yeah, just removing themselves from that doctor relationship that they don't feel comfortable with?
Yeah, I think that's a great question. So if you currently have healthcare providers that are caring for you and you're uncomfortable sharing certain bits of information with them based upon the relationship you're trying to establish, that doesn't necessarily mean that you should end the relationship per se, because you've established something depending on how long you've been with them. An option to explore could be, do you feel comfortable bringing a family member who may be a confidant, who may know more about your personal history? Do you feel comfortable bringing them in to an appointment with you to help you to advocate for yourself? If that still may not work, or you don't want to go that route, oftentimes you can talk with your faith-based community, or you can ask others in your neighborhood what primary healthcare providers do they go to and which ones would they recommend. I also encourage consumers, we're all consumers of this service, healthcare, is to look on the website, Google certain healthcare providers. There are certain ratings certain healthcare providers can have, because the more you're informed in terms of making the decision, the more you'll feel empowered to advocate for yourself. So if you already have a healthcare provider and it's just a matter of you establishing rapport, and you want to build your confidence in that, you could bring someone along to advocate for you. I do recommend having an advocate for you, whether you are going to a doctor's appointment or whether you have to be hospitalized, because it helps to ensure your needs are being met and your uniquenesses in terms of your healthcare experience is being addressed. Also, too, again, you can tap into your faith-based community, ask them. You can search the internet as well, and just dialogue with family and friends to ask, well, you know, what's your healthcare provider? What about your friends? And then go from there. Those are some strategies that I have found to be helpful. And then if you go to that first visit and you don't feel comfortable, it's up to you. Do you want to try a second visit, or do you want to try someone else? And it all depends on health insurances that you have as well, depending on if they're in a network or out. So it could be a cost if you go outside of your network. But the more informed you are about the providers in your area, based upon your healthcare insurance, because usually there are options, but it's just exploring those options.
So true. So very true. Thank you for that. Very informative response. Very informative response. So if there's no further questions, again, I want to thank our speakers for being here tonight and sharing this platform with us on our Be Fearless, Save Lives campaign. This has truly been an incredible campaign, and I encourage you all, if you haven't visited our website yet or been on any of our social medias, to take a look back at some of the resources we've posted throughout the month. They're super informative, and I think everyone has a right to have access to the information, because that's also another piece to it. I also just want to close with just sort of like general housekeeping with Kiki Cancer and the Cancer Support Center. We do have upcoming things that I encourage you all to go to our website and check out. We'll be definitely have more conversation around cancer prevention, around the importance of building relationships with your doctors, around community engagement, and how, as Dr. Myles put it, we could partner. Because in essence, this is all about partnership and really supporting each other and enhancing our lives. That's what it's about. And so I encourage you all to take our pledge and to go to our website to get more information and resources on cancer prevention and screening, where you can get screened in your neighborhoods. And yeah, just follow the center, follow our incredible speakers here as well. And if that is all we have, thank you all tonight. Thank you all.
Thank you all. Was this helpful to you all? Do you
Yes,
feel like it
can
was
we?
helpful? Yes, okay, so you can take this and move forward and feel more empowered, right?
Are we going to get screened? Is the question. We have some people that are going to get screened. Can we get some, if you haven't already? Okay.
It was helpful to me. I learned I need to borrow some of that energy next time I speak.
Send it in your way.
Thank you, everyone.
Thank you all. It's been a pleasure.
Thank you, everyone. Thank
We're in
you
it together.
all.
Hi, thank you.